All right. Good afternoon. Good afternoon. This is Committee Chair Mujahid Muhammad. I would like to welcome you all to the September 11th Safety and Wholeness Committee. If you have not already done so, please mute your phone and or computer. Anyone who does not mute their phone may be muted by the call moderator or removed from today's call. Additionally, please turn off your camera if you are not a board member or the CEO and her staff. I will now read a roll call of the board to identify who is present. I want to first thank those who were able to make it on, as the board commissioners are at off-site at a conference, and we each are finding ways to join today's meeting. So if you are here, thank you for being here. Please identify yourself first. For the record, Commissioner Esposito, Commissioner Chicas Guzman, Commissioner Simmons, no, Commissioner Simmons is on, maybe having some technical difficulties, and we have Commissioner
Chicas Guzman, yes,
as well. Okay. And Commissioner Slater Harrington.
Commissioner Slater Harrington, present.
Commissioner Simmons is present too.
Good afternoon. Good afternoon. Thank you each again, as I know that we are finding the best ways to join today. Members of the public who would like to provide comment to this committee can do so by signing up the date of the meeting up until the start of the meeting. Up to 5 individuals will be given the opportunity to provide comment to the Safety and Wholeness Committee. Speakers will be granted 3 minutes. All public comments should address safety and wholeness issues. Individuals or groups interested in providing public comment to the committee may sign up in 3 different ways. You can email us at public.comment@bcps.k12.md.us. You can always give us a call at the board office at 443-642-4095. And as always, our doors are open at the board office at 200 East North Avenue, room 406. And finally, the chat function during today's virtual meeting will not be used for gathering feedback or answering questions from the public. If you have follow-up questions or feedback to provide the board, email us at schoolboard@bcps.k12.md.us, and the board office staff will provide a response. And again, I want to thank everyone for joining our first Safety and Wholeness meeting of this school year. And we're going to jump right into our work. I think that we get started today with the Office of Health and Specialized Services. So you are welcome to take the floor.
Good afternoon. Thank you for the invite. Good afternoon, Commissioners Slater Harrington, Esposito, Chicas Guzman, Simmons, and Commissioner Muhammad. Thank you so much for having us here today. I am joined by one of my teams in the Office of Health and Specialized Student Services, Valerie Dudley Cook. Dr. Adrian Cisse and Ashley Collins will be joining the presentation. I also will be joined by one of our partners from Hazel Health, Steve Gatlin, and we will go ahead and get started. So, first, I would like to share our mission with you. Our mission here, I won't read it verbatim, but we are committed to ensuring that every student in city schools has the support and resources needed to fully access their education and thrive. Even when facing physical, mental health, and societal challenges, we want to make sure that all of our students are successful. As we go to the next slide to tell you more about our work, the next slide shows that we have our work broken into 3 different buckets. The buckets that they are broken and categorized is the different bodies of work that come under each of the different individuals. So as you can see, we have a component under home and hospital. Won't read all of the different areas, but they are there for you, and we are going to unpack this information for you in this presentation within the time that you have allowed us. We also have an area for specialized services with the areas that you see here at the top middle of the screen identify. And then for health services, we also have areas that are identified here that we will unpack for you in this presentation. At this time, I am going to ask one of my colleagues, Dr. Cisse, if she would come up and start us with the McKinney-Vento program updates, and then we will continue to move from there.
Absolutely. Thank you, Edie Goodwin. Good afternoon, everyone. I just wanted to provide some updates from the McKinney-Vento program. Next slide. One thing that was awesome this school year is that the JFE policy at city schools was revised in July of 2025 to align more with our MSDE changes. The McKinney-Vento liaison, the use of wording to reflect equity of students, and defining the support for school-based liaisons were just some of the changes that were made to this policy. And so we are excited about this and so eager to share and train our schools around the McKinney-Vento policy as well as the McKinney-Vento law. Next slide. Here is just a snapshot of the expectations of the school-based homeless liaison, just so everyone will understand that they work in collaboration on the school level with our office. They help us identify students and enroll students. They help with access and advocacy, communicate and collaborate with us as well as other entities, as well as support with transport. So we rely on these folks at the school-based level. They do an awesome job in helping us link students with services and get the help that they need within the school community. And so this is just, like I said, a snapshot of what they do within the school. Next slide. So now I'll turn your attention to our telehealth update. Next slide. Another update that was made this year within the ADF policy, and that's the wellness, nutrition, and physical activity policy around student wholeness, is that the telehealth protocol was added to our board policy ADF to reflect telehealth services for K through 12 students. Now, this is based on the new legislation that requires all districts within Maryland to provide telehealth services options guided by the MSDE as well as MDH. Now, this is not the same support as we use for Hazel at this time because Hazel is a vendor. This is a policy that applies to student or parent-initiated appointments. Because it's initiated, what we want parents to do is physically be present when students are having these services online within the school, and also work with the principal to have these things scheduled. So that is also within the student handbook, all of those regulations and how to actually ask for permission to do a telehealth appointment within the school during the school day. Next slide. So who's responsible for Hazel, you might ask? So with the Hazel Health, we work with our school-based student support team to help facilitate appointments or telehealth appointments within the school during the school day as well. So we have a team to work on Hazel, and then we have administrators to also help with the parent and student initiated appointments only. Next slide. So you'll hear a little bit more about our partnership with Hazel, but this just gives you just a snapshot of the work that we did last year with Hazel, and it is so awesome. About 1,949 students receive telehealth services, and a lot of that is usually in school as well as at home, so it's so versatile. And so we are continuing our work this year, our second year, to make sure that we are improving services with our partner and Hazel. Next slide. So our student wellness support team is still once we have a district-led team as well as school-based teams. And our goal is just simply to support students and family in understanding or knowing who they can come to within the school of a safe and subject matter expert with wholeness. And these are just some of the folks that can do that particular work. All of these bodies are a collective body that contribute to the student wellness as well as district and team services. Next slide. So this district team, because we are a collective body, this year we made a couple of changes. We are making sure that all of us participate and facilitate our district meetings on a rotating schedule. And we also meet every second Wednesday of the month at 10 a.m. Next slide. With our school-based teams, the goal of the district team is to support the school level teams to make sure that they are fully operational, that they are meeting with success and referring students and helping families. Each member should have a designated member on their school teams. And our principal and designees are also the point of contacts within that student-based program. Next slide. I think I missed that one. Yes, that one. Thank you. So this is last year's year at a glance, and what we did last year is we enhanced our oversight by making sure we capture data around the monthly meetings around those school level teams. And as you can see here, we made a number of referrals that came through the student wellness support team. Some referrals went to our ESBH mental health services. Some of them were self-referrals and or other services. We had referrals for students experiencing homelessness as well as state care. And so our total number last year of referrals was 325. This year, we're hoping to do a little bit better than that as we continue to work toward a more enhanced programming. And now I'll turn it over to Valerie Dudley Cook with our student health updates. Okay, well, I don't see Valerie.
I wonder if she has access to, as she listed as a presenter. I know we had her on the list.
Yes, we did make sure that we shared the name and
I see
she was
her.
put on there.
You
I see her
her?
too.
Tanisha, did you have her? She's here. She was
Okay.
one of the ones we sent over on the list.
Okay, I'm looking for her name. What's her last name?
Dudley Cook.
Okay.
She's actually in. I see she's actually in the meeting.
Yeah, she's in the meeting. Yeah, it's just a question of whether she has presenter rights, I think.
Yes, she does. She is now presenter.
Okay. Valerie, you should be able to speak now. Take yourself off.
Yeah, I Can you hear me now?
Yes,
Yes.
we can. Thank
Okay.
you.
All right. So I'm going to speak just real quickly about immunizations first. So our goal is to make sure that all students are immunized and healthy for school and are able to prevent illness that would keep them from attending school. So right now, to make sure that all students are up to date on immunizations, we've been offering immunization clinics right at district headquarters at 200 East North Avenue. They started on August 29th, 2025, and they have continued last week. We will have another clinic tomorrow and next Friday. This is along with the Baltimore City Health Department also providing immunizations at their location. We had LifeBridge and Grace Medical provide immunizations to 14 schools around the city. And we also had Total Healthcare provide a few immunization clinics to other city schools to make sure that we were covering areas of highest need. So we're still organizing numbers. We still want, we will have final numbers at the end of the week, each week, so that we can update to see where we stand by the end of the month. City School Nursing works with university partners providing nursing services at 37 schools. And there's 23 nursing FTEs. Next slide. So Baltimore City Public Schools does also have a dental program where students can be seen by a mobile dental clinic at their school location. And this is a great way for students to be able to keep up with dental care that they may not have access to any other way. And this has been a program that has been in process for a long time, and many students have been seen and have been able to keep healthy smiles for the last several years. Vision for Baltimore is a program that started many, many years ago. As you see, 2,400 students are screened. Over 18,000 glasses have been prescribed during the 24-25 school year. This year, students in high school will also receive free replacement pairs within 18 months of their exam. So that's something new, I believe, this year. And there are 1,322 active high schoolers eligible to receive services this school year. And each year there is a different grouping of schools so that it usually works like on a 3-year basis. So not every school will be seen, of course, every year. It's just not feasible to do that. So every year, a different number of schools are pre-selected to be seen. And I think that's yep. Thank you.
Thank you. We're going to bring up Ashley Collins at this time.
Good afternoon. This is Ashley Collins. I'm going to talk a little bit about the partnerships with mental health providers that we have for city schools. First, we have the Expanded School Behavior Health Program, which has been a program with city schools for over 30 years. And then the other way that we have mental health providers in schools is through an MOU process that's vetted and procured through the our offices of the Office of Health and Specialized Student Services. Next slide, please. So we just finished our most recent procurement that we do every 3 years, and we have 11 providers for the upcoming next 3 years. The providers are listed on this page. So our next procurement will be in spring of 2028, and these are the vetted and contracted mental health providers for city schools for the next 3 years. Next slide. This is our data collection from last year. We had 10,866 students served through the Expanded School Behavior Health Program. We were able to provide over 16,000 consultations for teachers. We also have a few substance use providers in the schools, in about 15 of our city schools, and they were able to work with 243 students last year. And we were in about 130 schools. Next slide. Another partnership that we have right now is through the Consortium on Coordinated Community Supports at the state level. They have just completed their current procurement, and we have 16 providers with programming that were selected through this process. They're all in different phases of their MOU process currently. A lot of them we also had in MOU as partnerships last year. And you can see some of them listed on the screen, but there is a full list of 16 with the little descriptions available. Next slide. Thank you.
Thank you very much, team. Commissioner Muhammad, I wasn't sure if you wanted us to go right into the partner or the partner presenting, or if you would prefer that I pause so that you could take it from here.
Let's pause to give a chance for some questions from my fellow commissioners. So I will open the floor for questions. But before we get started, I just want to say this. I just want to uplift the district's effort to really roll out a comprehensive approach to student wellness, especially the effort to integrate the student wellness support and the support teams and the expanded behavioral mental health work and all of the partnerships that exist, including the work around the consortium. I think it's clear that as city schools, we're moving towards a model where every child has access to safe support without barriers. I think we have work to do to get further along. And I'm sure that the questions that arise are going to be how do we further the work that you're doing? But I have to say that in starting this school year off with this report, I'm happy to see that we are doing the work that we set out to do and we said we wanted to accomplish last year. So I will open the floor for comments. Feel free to jump in as needed, commissioners. Commissioner Simmons? Good. All right. With no questions, hearing none, hopefully everyone's mic is working. I will get started. When I look at the data that you're providing, one of the questions that comes to mind is around clustering. Really understanding where these numbers live. Are there some areas of the city? Are there some grades that we are receiving more participation than others? I think it would be helpful just to see where the impact of the work lives, ensuring that it's across all grade levels and across all schools throughout the city. And that's something you can give us at another time unless you already have some insight into that. I know that may take some time to be able to provide us. I think that my second question really relies on when we look at some of the dollars that we are spending, whether it be in a virtual space or it be in a in-person in school, really understanding the return on investment would be helpful to the committee. And when I look at return on investment, one of the things that I would like to see is that cost per student generally for the service. What is it costing us as a district? And do we see an increase in attendance when children are receiving these supports? So those are questions that come to mind. If you can address them, feel free. And if not, we can touch them at another time, as I know that these are database questions which may need for you to respond in writing.
If it's okay with you, Commissioner Muhammad, we want to make sure that we have visuals for you instead of us just like coming up with numbers. So we will make sure I jotted down the notes and we'll make sure that we provide that information for you. So I have the cost associated with this and the impact on attendance.
Yes, impact on it. We can look at the impact on attendance. Particularly, we are very concerned in scaling the ways. If we have options that are working, that you're currently doing, and they're helping to get our schools. They're showing that kids come to schools when they receive this level of support. We intend to scale them. So that would be definitely helpful. So with that, again, if there are no questions from my fellow commissioners, let's move on to our community partner. Welcome.
And Commissioner Muhammad, while the partner is coming on, I just wanted to let you know that we are in conversations with health professionals and some university partners around how attendance and the health piece tie in together. So we'll make sure that that we share that information with you.
Okay, thank you very much. I appreciate it. Good to know. Thanks for the insight. Hazel Health, welcome to Safety and Wholeness. Thank you for taking the time to present to us.
Well, it's our honor to be here. I am joined by Amber Dutton, who is one of our clinical supervisors. So hopefully Amber is able to hear and see okay, but I'm looking forward to the conversation. Honored to be part of this conversation, and I'm just delighted to share some of the work that we have done together over the last school year. I do have slides, and I don't know if I am to share my slides or if the slides have been loaded already. Possibly that someone could let me know. I'm happy to share if that's easiest. Beautiful. Okay. So just to set a little bit of context for some of the conversation we're going to have, we are a telehealth, teletherapy provider, and our mission has largely centered on augmenting and supplementing the ecosystems of support that exist, certainly in city schools and in other districts. And the idea here for us has been to increase the level of access to care in the face of significant constraints and barriers to that level of care that specifically we see on the mental health side of the equation. So that's what we're doing. If we go to the next slide, we are often able to hear voices of families and those that we work with. And I think this is a quote from a family that illuminates a little bit of the work that we aspire to do with all of you. And I think the threads here that make me proud and honored, and this is all because of our partnership with the great team at City Schools, is that we had connected a student. This is the quote from a family, but a parent talking about a nice connection with the therapist and the help that their son, and also help for their son, excuse me, and help for the family as well. And also just a little bit of the reality that at times we do have to work through some growing pains with this concept and with therapy. And I know there's a lot of mental health. I know Ashley's on the call, and I know she could speak at this for volumes. But I think we're pleased that we are beginning to make the conversation about therapy, along with the great team at City Schools, something that's more comfortable and more connected to something that's beneficial for students and families together. So on the next slide, some of the headlines that we saw this year were, and what we aspired to work towards, were achieved. We saw a significant material increase to mental health services. It was really awesome to see some of the numbers Ashley showed, and we'll talk a little bit about some of the access to the Hazel program. But we saw that there was an increase in access. We did see a measured reduction in the severity of mental health symptoms, and we did see strong family and staff comfort with this modality of care. So teletherapy is not, many of us have had telehealth visits and overall is not incredibly new, but I do think it is newer in the teletherapy side, and certainly newer when we talk about student either school-based or at-home teletherapy. So those are notable achievements. And of course, we're looking to continue to do better and more to align with your goals. And I love the comment about attendance. I think that's something we will share some feedback on from our lens, and also things like behavioral infractions and ultimately student success. On the next slide, you'll see a little bit of one more, I'm sorry. I think Adrian showed this earlier. I will just add, without reading the numbers to you, that there are some notable things here. And I think the fact that in the first year of a service that we had 76% of schools engaged is a real testament to the leadership in the district, leadership of this team, school leadership, and more, because that is an impressive engagement sort of breadth sort of signal to us. 180 staff members made referrals to the program. And then you see the numbers that underlie overall, the 500 students ultimately participated. Just a second of context here before we dive a little bit more into numbers. The program is meant to be, again, supplemental to the existing ecosystem. And really the area of focus for us has been students with emergent symptoms, mild to moderate symptoms. We're hoping to intersect with students that are at the early stages of their mental health journey so that we can work with those students to develop skills and tools to self-regulate or manage those emotions in a way that doesn't have an elevation that then becomes problematic for all the other measures of students' success. So there's an element of proactivity here. There's an element of emerging symptoms. And we know that numbers suggest that, of the number of students that have a mental health concern, 80% or so do never receive treatment for that mental health concern. There's numbers that the CDC has shared. So there's certainly an opportunity to work with more students or youth with mild or emerging symptoms. And this is an attempt to do that, dovetailing with the broader efforts across the district. These sessions can happen at school or at home. So every school is enabled with an iPad and training and things to do visits at school, or they can happen at home. There is always, of course, family consent. And of course, all of the HIPAA and FERPA requirements are aligned with. One other thing I'll say before we move on is that generally the course of treatment is what I would call short term. Now, short term doesn't mean 1 or 2 sessions. It typically means 8, 10, 12 sessions. They're weekly sessions, and they occur, of course, with the same therapist. We have a large Maryland licensed therapist team. But that is a flexible number. Some students can really work through their issues and develop the skills or tools to be successful with 5 or 6 visits with the therapist. Others might need 10 or 12. We don't cap the number of visits, but I think we try to articulate this as something that is not looking to be similar to the more significant services by ESBH or other things where that might be a longer term engagement. So again, mild to moderate emerging symptoms, short-term therapy, both at school and at home. Okay, so let's move on, please, to the next slide. The reasons that we're seeing students are varied, but certainly the feelings of sadness, anxiety, and withdrawal has been the leading reason. But we also see things like students just struggling in school, and a sense that there may be a behavioral health concern underlying that struggle. Challenging behavior, certainly, expressing oneself, anxiety. I think the headline here really is that there are a multitude of reasons. And again, anyone on the call from the behavioral health team can certainly lean into this and agree that the variety of symptoms are significant, but certainly the leading ones really are centering around things like sadness, anxiety, and withdrawal. And this is what we see in the referrals that are made to Hazel. Just a note that these will not add to 100 because a referral can have more than one reason. Next slide, please. We saw a significant ramp up in the visits. So this graph here shows visits by month. And just a reminder that there was a very strong implementation strategy that the district put together to phase this in over the course of last school year so that there was ample time for schools to understand the why and the how of this service and to not rush it, because we wanted to make sure that it was digestible and folks could get their hearts and minds around it, frankly, to understand where it fit. And Dr. Cisse, who led the implementation from the district side, did a wonderful job leading this in a way that I think led to the sorts of engagement numbers that we're seeing here. So the way to think about this is if you look from left to right, we saw the slope of visits really begin to increase as we moved through the winter into the spring, where we were doing at the end of the school year 350, almost 350 visits a month with students. The purple here indicates those sessions that happened at school. The gray indicates sessions that happened at home. So we're also seeing that families have liked the flexibility of having choices where it comes to where that visit should be. And again, we support both. And as we got into the later months of the spring, roughly 40% of visits were happening at school. A quick note too, that over the summer, we worked with students, and actually we had about 500 therapy sessions over the summer months. And these were all done at home, of course. And these were students that we provided some scaffolding to, supports to help them get through the summer. And we're hoping being more ready for school now that we're in the back to school season. Next slide, please. The grade range spread, I know this was a question asked earlier, was across the district. So we worked with students from every grade level, but certainly we saw this hump in the middle here. And this is conforming with our national curve. So we typically see an incline up into the middle schools, and then we do see a little bit of a taper when we get to high schools, but the sweet spot has really been this middle bracket. And in city schools, the middle became a little bit broader than we see in other districts. We saw first graders and second graders as engaged as seventh graders and eighth graders. And our team will adapt the therapeutic approach to the age of the student. I know Amber's on the call and can certainly speak a little bit to that if you're interested, but certainly the ways in which we'll work with a first grader on a teletherapy visit will be different than the ways in which we might work with an eighth grader. So we're adaptive to that dynamic. But I think the headline here is that there was engagement across the grade levels, across all the grade levels in the school district. Next slide, please. And some schools really had very, very strong adoption. We had adoption from, I said, almost 80% of the schools, or over 70% of the schools, but these were some schools that really had some of the higher engaged numbers. So Roland Park, Hamilton, Tunbridge, Green School, et cetera. And you see the number of students in that second column that were served at each of those schools. So just an example of how that looks at the school level. And then on the next slide, we also talk a little bit about something that's really important, and that's activation rates. And when we have a service that, whenever there's a service that is provided that requires family consent and enrollment, we know that there will be barriers to completing that process. We know that there will be things that not every referral, for example, will ultimately end up as an activated student. Again, an activated student is just a student that was referred that started services. The biggest thing we saw in city schools was just an inability to contact families. And a lot of this was just things as simple as, phone numbers that were out of date, maybe in SIS or in other systems. So, we're going to be working this year on some efforts to close that gap, because we don't expect every family will consent and move ahead with the program, because that is not the expectation for any service. But I think we want to sleep at night at rest knowing that every family had clarity on the opportunity and had an opportunity to understand the program. And I think when we're unable to make contact with a number, that obviously hasn't occurred. So that's what we're going to be working hard on this year overall. Next slide. But there were certainly some schools that really were impressive with activation rates. And this is a signal to me that when, again, because the staff members can make referrals, it can be a social worker or a school psychologist or others, that they're sort of matching the students up with that fit the program. And these are numbers that indicate that when you see activation rates at 100% or 90% or over 80%, that really signals that the school staff has done a really good job understanding the fit in the ecosystem, and the students that might be most appropriate to this modality within that ecosystem. So these are just some schools that had very high activation rates. And I think 2 of them in green had also very, very high engagement rates as well. So the number of students referred were quite high as well. Next slide, please. We did see very promising data around behavioral improvement, if you will. And Amber Dutton can speak to this if there's interest, but I'll just give you the headline here in that we look at we use something called the PSC-17 to evaluate. It's a questionnaire that we give students at intake, and then we give the we do the same thing at discharge. So at the intake meeting, we go through it, and there's a score that's associated with the survey. At the end of the Hazel program, we then go back and do the same survey, and we look at the delta. We look at, did things change, and we look at how many students had what is called reliable change or clinically significant improvement in those symptoms. And it was very heartening to see, thanks to the leadership in the district, that 80% or 81% of students that engaged with this, with the Hazel therapy saw improvement, significant improvement in their mental health concern. And that beat the national average, which is great. I will also say that the area that seemed to be the most, where we saw the most improvement were externalizing behaviors, fighting, teasing, things of that nature. There were improvements in all areas, and there's internalizing behaviors and attention-based concerns, but externalizing behaviors was an area where we saw significant improvement overall. And I think just maybe on the last slide are just some things that we're working on, some opportunities that we have this year. And I think we want to make sure that we are helping schools with at-school visits. So at-school visits do require some collaboration and some coordination, because we have, when the visit happens at school, the student will come down to the location where the visit occurs. There'll be a school staff member that will welcome the student, start the session, and just be in the proximity so they are reachable if the student becomes emotional, or if the iPad comes unplugged or something like that. So I think there's an opportunity for us to work within the ecosystem of support to make sure that we that the success rates for those visits are higher. And I know we've had some great conversations on that already, and including the support team concept. As I mentioned earlier, we're going to be working on activation rates. We made some significant improvements in just the way we even reach out to families. Not just using phone calls, but using text messages, using emails, because reaching any of us in this day and age is something that has to be done via various touch points, because sometimes we don't answer our phone, or sometimes we don't reach your email. So we've been working hard at the concepts to improve activation rates. And we certainly want to connect with those schools that didn't use the service last year, just to understand if there's a barrier that we can improve upon. Possibly there's confusion about the service, or possibly there's something that we could understand that might help them feel more comfortable using the service. And if they don't use the service, of course, that's okay. There's no pressure to use the service, but we just want to make sure there's not a barrier that we can work with. I know that there's been a conversation, Dr. Cisse and others have illuminated this, about whether it's feasible to have school counselors more engaged in this, along with wellness teams. And I think that's an ongoing conversation. But I will say that and every district is different. So because it happens in one district doesn't mean it has to happen in every district. But certainly the involvement of counselors, school counselors, is something that is pretty dominant for other districts we work with. But again, every district is different. So I think there's an interest in exploring this. I'll sort of close by one of the things that we certainly, we heard this on this conversation earlier, that we do want to link our engagement with material improvement areas that the district is focused on, attendance being one of them. And I will say that we have done in-depth impact studies with a few very large, Duval County in Florida, Ferguson in Missouri, that have actually done deep analysis of whether behavior, the Hazel therapy program has helped students versus a control group around their attendance trajectory. And we have seen that it has. And we can share that study with you in more detail, but there's some numbers that have come back that show a pointed improvement in attendance for students that work with the Hazel program and work with, frankly, any behavioral health program, including ESBH, of course. But I think the concept that attendance has a connection to the behavioral well-being of students is one that has been certainly proven in the work that we've done, and we would be delighted to explore that with all of you in terms of how we might assess that within city schools. I am going to pause there. We can take any questions you might have, and Amber Dutton, who is our clinical supervisor, certainly can answer any clinically oriented questions you might have, but I'm happy to provide the floor back to you all.
Thank you much. First, want to thank thank yourself and the Hazel team for making yourself available and coming to us to share the data around the impact of your work. And also thank you for your commitment to our young people in city schools. I want to open the floor to my fellow commissioners for questions.
I may have, I'm sorry, I may have missed this, but how are parents notified, and how do you, with this kind of being a kind of new, like what was the work around getting folks on board?
Yeah, it's a great question and a very important question. There's a couple things that we have worked on with Dr. Cisse and the team. So there's the broader district level communications with social posts, flyers, things like that went out from the district team. And we provided that team with pre-written material so that was an easier lift for them to sort of promote things. We also gave the school teams, the principals, the counselors, materials that were similarly oriented to just speak to parents about this in a simple, sort of not confusing kind of way, and let them know that it was available and how they could engage in it, and even some signals about like how it, what it might be aligned with in terms of how your student might be feeling and behaving. I will say that the real driver of this is really the school staff themselves, who are usually to use the word, evangelists for these sorts of things, and I think that has been largely due to the credit of your school teams and all the folks in this call that has been the predominant, I think, vehicle for family awareness, that a counselor or a social worker or a school psych, I should say, connects with the family and has a conversation and just kind of alerts the family that this is an opportunity. And I think they've done a wonderful job at that overall. But I will say that it is in a noisy, busy world, it is an ongoing challenge to capture, mind share. And I think we're continuing to work hard on that this year. I hope that answered your question, Mr. Simmons.
It did. Thank you.
Any other commissioners with questions? All right, so it's on me. I do have a couple of questions, but I'll leave it to two. While you're going through your slides, some things stand out, and I think that the question that really stuck with me was the profile of the student or family that's going to take advantage of the service you offer. We see that there was a spike in late in middle school, and there was a strong we didn't see as much participation later on in high school. So can you speak towards the profile of students and families that are taking advantage of this resource? And maybe can you offer some insight, particularly when it comes to our high school students that aren't taking as much advantage of the resource as at least as a district we would like them to?
Thank you for the question. And I think someone else might have popped off their mic. Did I cut someone off? Okay. I will say that The first thing is that the curve that we saw for the kind of the grade utilization, where we saw the bubble in the middle, sort of, and the elementary is consistent with the national curve. So the taper at the high schools is not unique, if you will, in Baltimore. And I think there is no programmatic reason for that occur. I have talked to many folks in city schools and other districts that sort of point to some things that are worth thinking about a little bit there. There is certainly some scenarios at times where maybe the level of acuity of concerns at that age has risen to a level that might be best addressed via a more traditional in-person modality of care. I think there is some sense that also the resources at the high school to work with students with behavioral health concerns, even though high schools are bigger, there seems to be some sense that the infrastructure of behavioral health supports at high schools might be a little bit more resource than might be at a middle school or an elementary school that typically might have one counselor or one person. So I think there's some of that that weaves into it as well. I will say that I do think we can have conversations with the high schools this year to better understand maybe our fit within their existing ecosystem, because although the curve does suggest that we're the sweet spot, to use that term, is in the middle, I don't necessarily subscribe that the taper is something we should accept, and I think we should lean into that a bit. So I would love maybe not on this call, but leadership thoughts and counsel from all of you and others on how we can best approach that conversation. But I do think we do want to lead into that for sure moving forward. I hope that answered your question, Mr. Mohammed.
No, it definitely does. And I think my next question, as you are a resource to our families and during times of risk, and there's something that, and I think this may lean more into the clinical approach and partnerships you have with our schools, that risk arises and you're able to respond. Just being able to hear about, from a clinical stance, how a family using this virtual option is being supported in comparison to someone who has a clinician who may be face to face, and being able to hear around those family relations that often built when you are having that face-to-face engagement. Are those same? Is there room for those same relationships to be built in this virtual option? And how can we take, as a district, advantage of scaling our work with you? Because I'm sure you have the ability to take on more, but particularly during those times of crisis, how do we do more?
I think Amber has come off. Let's see if Amber Dutton. Amber, are you able to join?
Yes, I can't get my camera to work, but can you hear me?
Yes.
Okay,
Yeah.
perfect. As a supervisor over our clinical teams, I think this is one of the things that we absolutely aim for, is building that rapport with families. And so from the onset of having that intake appointment, that's really where we lay the ground of really explaining our services, because we understand that there is still a stigma and uncertainty about the use and effectiveness of virtual therapy. As a licensed clinician myself, I have established some of the best relationships in a virtual setting where it doesn't feel like we're talking across screens, but you actually can build and hold that same therapeutic space. And so I think one of the things that we really aim for is we listen. We really try to take in the feedback of what the parents and the student are looking for. And I have a great example. I was just working with a parent today for a student with gender identity concerns, in which the parent really wanted to make sure that the therapist was equipped with the clinical background to be able to work with that student. And while I have a really great therapist, the parent felt that the therapist's approach was more appropriate for younger students versus a high school student. And so I called her, listened to her concerns, and went to my team of fellow supervisors to really see if there was a therapist that met the needs of what the parent was looking for. And so that is always our aim. We can transfer a student if there isn't a good therapist match. Of course, we really work with our clinicians to try to hear and adapt to the concerns that the family and the students have. And so while we do virtual therapy, it's very interactive. Our therapists know how to adapt their interventions and techniques, even though they're virtual sessions, whether that's virtual games, sending worksheets and homework to the students. They never like to hear the word homework, but giving them activities. And so whether that's coordinating with the school to say, hey, we're gonna, and I'm gonna use this because kids love it, we're gonna be making slime today. And I wanna make sure that you have some of your materials ready so that we can complete this activity. Or, hey, mom, dad, we're going to be working on this. And I would really love, if we're going to do a calming jar, for example, do you have these supplies available? And some of my best therapists, they do try their best to meet the families at their needs. And I've had my therapists go and mail out supplies to their families if they don't have the means to be able to get those. And that just is a testament to going above and beyond in terms of making sure that clinically that these students are going to be able to get what they need out of these sessions in a virtual format. And then to that other piece, and then I'll be quiet, but to that other piece, we also will look at making sure that we understand that telehealth may not be appropriate for every family. And so I encourage my therapist to definitely try a few sessions, and myself and assessments have said, if we feel that this is not appropriate, what we're going to do is now coordinate care and see what services are within your community. How can we involve your school supports to see if there may be a better match? And so I think that's kind of how we work on both sides of it. But I think we have a well-equipped team of therapists that are truly trained to be able to support families.
Thank you. I appreciate that insight. I think the benefit of having partners come on is we often hear reports, but being able to hear directly where the strengths of our partners lie is always helpful for not just us as a board, but for the community as a whole. So Hazel Health, thank you for providing us your time, your strength, and your commitment to our students. We hope to see this year the scaling of your work and your impact in city schools. Again, thank you.
Thank you so much.
Absolutely. So we're going to move on to our next, and I believe our last presentation for today's committee meeting. We have a compliance report review on the behavioral threat assessment, and the floor is yours.
So just reminder that what I had been told by the board chair was that we weren't doing presentations anymore for compliance reports. We were just opening it up for if there were questions.
That is correct. That is correct. So if you can come on around the behavioral threat assessment, and I will open the floor for fellow commissioners with any questions. You unmute.
Hello again. I believe there are some others who are coming on as well, but I'm here if you have any questions to start off with.
So there are, it looks like we're gonna get out of here with no questions. I was satisfied. So I think that we are in good shape.
Great.
All right, just came through, no questions. All right, so thank you. Do we have any public comments for today's meeting?
Hello, good afternoon, Chair. We do not have any public comment for today.
Great. This is timely for us. This is a good start. So we are going to stop here. I want to thank everyone for joining today's Safety and Wholeness meeting, committee meeting. We will be, I believe, we're every third Thursday of the month. Is that correct, Nisha?
We are the first Thursday
We are the
every month.
we are the first Thursday of every month. Things switch. We are the first Thursday of every month. We look forward to having everyone participate. I want to also take this time to encourage everyone who is joining from the public that if you have not signed up to attend a CEO search community listening session, we want to encourage everyone to do so. And we usually leave our meetings, we have a process of which we leave with a quote. We will continue that this year. And our quote for today is find it in yourself to fight against complacency. Because your complacency is mirrored by those who look up to you. And all of our students look up to us, and we are charged with ensuring that their future is bright. And a bright future is one that will never allow complacency to live. With that, have a good evening, and we will see you during our next meeting. For my fellow commissioners, we're going to jump over to another link.
Commissioner Muhammad,
Yes,
before you close, this is Tanisha. I needed to do an edit. So the Safety and Wholeness Committee meetings are actually the second Thursday of each month. Our next committee meeting is scheduled for October 9th. The agenda item will be the district wholeness goal update on attendance, and we have 2 compliance reports. JFBB students in state supervised care and JFE homeless students for that agenda. Thank you.
absolutely. Thank you. Thank you for that. So with that, commissioners, we're going to jump over to our meeting after this with the appropriate staff. And with that, may I now have a motion to close today's meeting as permitted by the Open Meetings Act to fulfill the board's administrative function in accordance with the annotated code of Maryland general provisions.
So move.
Thank you. And I will second that. Is there any member of the public who objects to us closing today's meeting? Hearing none, all in favor for closing today's meeting, say aye for those who have access to their speakers.
Aye.
Thank you, thank you. And with that, we are closed, and I will see you guys in our next session. Have a good evening.